Hello and welcome to my channel. In this video we will be looking at the role of chromosomes in sex and gender. Atypical sex chromosome patterns, Klinefelter's syndrome and Turner's syndrome, which you need to know for AQA ALEVEL psychology in the subtopic of gender. I hope you enjoy this video and find it helpful. Let's get started. DNA, genes, and chromosomes. DNA, deoxyribonucleic acid, is a self-replicating material found in cells that carries genetic information. Genes are short sections of DNA that determine characteristics of a living organism. Chromosomes are structures made from DNA found in the nucleus of most cells. Humans have 23 pairs of chromosomes, for a total of 46. Each pair carries genes that control physical and behavioral traits such as eye color, hair color, or predispositions to certain conditions. Sex chromosomes and biological sex. The 23rd chromosome pair determines biological sex. Females have XX chromosomes. Males have XY chromosomes. The Y chromosome carries little genetic material but determines male sex. All egg cells carry an X chromosome. Sperm carry either X or Y. The baby's sex is determined by whether an X or Y sperm fertilizes the egg. Prenatal development. At early stages, all embryos have similar external genitalia that resemble the female form. Around 3 months into pregnancy, if the embryo is male, the testes produce testosterone, triggering the development of male external genitalia. There is usually a direct link between chromosomal sex and both external, penis or vagina, and internal, testes or ovaries, genitalia. Atypical sex chromosome patterns. These occur when the 23rd chromosome pair deviates from the typical XX or XY pattern. Atypical patterns can lead to distinct physical and psychological traits and differences in development compared to individuals with typical chromosome patterns. There are 2 types of syndromes that can develop from atypical chromosome patterns: Klinefelter's syndrome and Turner's syndrome. Klinefelter's syndrome. Klinefelter's syndrome occurs when a biological male is born with chromosomes that have an atypical sex pattern of XXY rather than XY and therefore have an extra X chromosome. This means the individuals with Klinefelter's syndrome have 47 chromosomes instead of 46. It is thought to affect 1 in every 1,000 males. Individuals with this condition usually develop into a reasonably normal male but do have lower levels of testosterone. Physical characteristics of Klinefelter's syndrome may include less masculinity, taller than average with long gangly limbs, muscle weakness, coordination problems, general clumsiness, less body and facial hair, broader hips and softening, rounding or body contours, gynecomastia, increased breast development and tissue, underdeveloped genitals, poorly functioning testicles, sterility or infertility, risk of female health problems e.g. breast cancer. Psychological characteristics of Klinefelter's syndrome may include low libido, lack of interest in sexual activities, poorly developed language and reading ability, dyslexia, behavioral and temperamental passivity, attention problems, shyness and difficulties with social interaction, increased risk of anxiety disorders and depression, lack of ability to respond to stressful situations and problems with executive functions such as memory and problem solving. Turner's syndrome. Turner's syndrome occurs when a biological female is born with chromosomes that have an atypical sex pattern of XO rather than XX, and therefore only have 1 X chromosome and either an absent or partial second X. This means the individuals with Turner's syndrome have 45 chromosomes instead of 46. It is thought to affect 1 in every 5,000 females. Individuals with this condition usually live relatively normal lives, albeit with slightly reduced average lifespans. Physical characteristics of Turner's syndrome may include physically immature and retain the appearance of prepubescent girls, no menstrual cycle, sterility and infertility, undeveloped breasts and ovaries, webbed neck, broad shield chest, narrow hips with a high waist-to-hip ratio, small lower jaw, low set ears, shorter height than average, misshapen internal organs, medical complications, heart conditions, high blood pressure, urinary complaints, vision and hearing problems, and osteoporosis. Psychological characteristics of Turner's syndrome may include above-average verbal skills and reading abilities, below-average mathematics abilities and spatial and visual memory, social immaturity with trouble fitting in, and minor learning difficulties. Evaluation for atypical sex chromosome patterns. A strength of research into patients with atypical sex chromosome patterns is that it offers valuable insights into the nature-nurture debate. By studying the differences and similarities between individuals with typical and atypical sex chromosome patterns, researchers can better understand the extent to which specific behaviors and characteristics are influenced by genetic factors, nature, versus environmental factors, nurture. With research finding significant differences in physical and psychological characteristics of those with atypical and typical sex chromosome patterns, it can be inferred that this is because of genetics. This is a strength because it suggests that innate biological factors have a significant influence on behavior and development, allowing researchers to use this information to develop interventions and support strategies for individuals with atypical sex chromosome patterns, ultimately improving their quality of life. A strength of research into patients with atypical sex chromosome patterns is that it has real-world practical applications. Continued research into atypical sex chromosome patterns is likely to lead to earlier and more accurate diagnoses of Klinefelter's and Turner's syndromes, as well as more positive outcomes in the future. Ariely et al., 2011, conducted a study using a sample of 87 individuals with Klinefelter's syndrome, who had either been diagnosed in adulthood and childhood. They found that those who had been identified and treated in childhood were able to manage their condition significantly better, compared to those who had been diagnosed in adulthood. This is a strength because it suggests that early diagnosis and intervention, informed by research into atypical sex chromosome patterns, can significantly improve the management and outcomes for individuals with conditions like Klinefelter syndrome. A strength of research into patients with atypical sex chromosome patterns is that it has led to the development of treatments and therapies. Research into patients affected by Klinefelter's syndrome and Turner's syndrome has seen the development of therapies that help to manage their condition and improve their quality and duration of life. For example, the use of human growth hormone to treat stunted growth seen in those with Turner's syndrome and testosterone to treat underdeveloped genitals and lack of body hair seen in those with Klinefelter syndrome. This is a strength because it suggests that research into atypical sex chromosome patterns directly translates into tangible benefits, offering treatments and therapies that significantly improve the physical and social well-being of individuals with these conditions. A limitation of research into patients with atypical sex chromosome patterns is the inherent focus on defining atypical behavior based on a subjective understanding of what is considered typical. This is particularly problematic given that gender is a social construct. What one person deems typical, such as social skills in the context of Turner's syndrome, may be seen as atypical by another. This is a limitation because it suggests that there is a lack of objectivity when identifying atypical and typical behavior, as it relies on socially determined norms rather than objective criteria, leading to potentially biased interpretations and conclusions. A limitation of research into patients with atypical sex chromosome patterns is that it is biologically deterministic. Research into patients with Turner's and Klinefelter's syndrome focuses on sex chromosome patterns being the primary cause of behaviorally and psychologically differences with these individuals develop. However, it could be that these individuals develop differently because of environmental and social factors. For instance, individuals with Turner's syndrome may be treated more immaturely due to their childlike appearance and being perceiving as younger by those around them. Parents, teachers, and others may react to the prepubescent appearance of individuals with Turner's in a way that encourages immature behavior, and this may have an indirect impact upon their performance at school and their socially mature. This is a limitation because it suggests that research may overemphasize the role of nature and genetics and neglect the influence of environmental and social factors that could affect gender behavior. A limitation of research into atypical chromosome conditions is that the description of Klinefelter's syndrome suffers from ascertainment bias. In order to identify characteristics of XXY and XO individuals, It is necessary to identify a large number of individuals with the disorder and build a database, as this allows the full range of characteristics to be observed from mild to severe. In the case of Klinefelter's syndrome, only those with the most severe symptoms are identified, and therefore the picture of typical symptoms may be distorted. Boada et al., 2009, reported that prospective studies following XXY individuals, Klinefelter's syndrome, from birth found that individuals do not experience significant cognitive or psychological problems, with many being highly successful academically, and in their personal lives and careers. This is a limitation because it suggests that the current understanding of Klinefelter's syndrome may be skewed towards more severe cases, potentially overlooking the milder expressions of the condition and leading to inaccurate generalizations about the cognitive and psychological well-being of individuals with XXY chromosomes. A limitation of research into atypical sex chromosome patterns is that it is socially sensitive. Klinefelter's syndrome and Turner's syndrome can be diagnosed prenatally based on cytogenetic analysis of the fetus. A diagnosis of such may incur a demand or bring about pressure upon prospective parents to ask for an abortion, as some parents may choose to terminate a pregnancy based on the diagnosis, and this decision can be deeply personal and ethical. This is a limitation because it suggests that the knowledge gained from prenatal diagnosis of atypical sex chromosome patterns can create ethical dilemmas and societal pressures related to reproductive choices. Thank you for watching. If you have enjoyed this video, please like and subscribe for more content like this. Bye.